Ozempic personality suggests semaglutide can rewrite who you are. Ozempic can change appetite and how rewarding food feels. That can change thoughts and behavior around meals without changing your entire personality. The important distinction is whether interest falls only around food or across daily life. If music, work, sex, hobbies, friends, and future plans also feel flat, the problem goes beyond ordinary appetite suppression. When the change stays centered on food, some people stop planning meals throughout the day. Snacks become easier to ignore. Restaurants may seem less exciting. The constant background chatter about food, often called food noise, can become much quieter. That change may feel peaceful to one person and strangely empty to another. Losing interest only in food is different from losing interest across the rest of life. Snacks and restaurants may matter less while music, conversation, sex, hobbies, work, friends, and future plans still feel rewarding. That pattern fits the way Ozempic makes food feel less rewarding. Losing pleasure across many parts of life deserves a wider medical and mental health evaluation. Social media often groups these very different experiences under one dramatic label. Someone eats less and stops enjoying restaurants. Another person becomes exhausted because eating has become difficult. A third develops depression during the same period. Calling every one of these situations Ozempic personality makes the label memorable but too vague to explain what is happening. Mood, motivation, eating, sleep, blood sugar, and relationships can all change at the same time. Separating those changes helps identify what is actually causing the symptoms. The same outward behavior can come from very different causes. The pattern matters more than the label. In 2026, the Food and Drug Administration reviewed 91 controlled studies involving 107,910 participants. The review found no increased risk of suicidal behavior, depression, anxiety, irritability, or losing contact with reality. Across these studies, those mental health problems were not more common among people receiving these medications. Studies based on medical records give mixed results. Some report lower rates of suicidal thoughts among people taking these medicines. Others report higher rates of certain mental health conditions. These studies compare people with different levels of obesity and different histories of diabetes or mental health problems. Access to medical care can also differ. Those differences make direct comparisons difficult. Published reports describe individual patients who develop depressed mood, low motivation, slower thinking, or suicidal thoughts after starting treatment. When symptoms appear soon after treatment begins or after a dose increase, the timing deserves attention. Check food intake, hydration, sleep, stress, and other medications before assigning the change to one online label. One of the most common explanations is simply eating too little. Strong appetite suppression can quietly reduce protein, carbohydrate, fluid, and salt intake. The result may be fatigue, dizziness, poor concentration, irritability, and low motivation. These symptoms can look like a mood or personality problem when the immediate cause is too little food or fluid. Physical side effects can change behavior too. Nausea can make social meals unpleasant. Constipation can make someone withdrawn or short-tempered. Repeated vomiting can drain energy and worsen dehydration. If irritability starts after a dose increase while someone is barely eating, first check food, fluids, nausea, constipation, vomiting, and dehydration. Low blood sugar is another important possibility, especially in people also using insulin or certain diabetes medications. Low blood sugar can cause sweating, anxiety, anger, confusion, shakiness, or sudden behavioral changes. Better blood sugar control after starting Ozempic can reduce the amount of insulin a person needs. That is why insulin doses should be reviewed as blood sugar improves. Other drugs and habits matter as well. Antidepressants, stimulants, steroids, sleep medicines, cannabis, caffeine, and alcohol can all affect mood, sleep, and motivation. Menopause, thyroid disease, pain, infection, and poor sleep can do the same. A symptom that appears during Ozempic treatment still needs the same basic medical evaluation as any other symptom. Weight loss itself can also change behavior and relationships. Confidence may rise, clothing changes, dating changes, personal boundaries become firmer. Someone may stop drinking, overeating, or accepting every restaurant invitation. Friends or partners sometimes experience those changes as distance or rejection. That is where the phrase, "you are not yourself anymore," can become misleading. Sometimes the person is simply living differently. Their routines, priorities, or boundaries have changed. A familiar relationship pattern disappears, and the people around them notice it before they understand why. Depression affects more than food interest. Depression can reduce pleasure across nearly every part of life. Music feels flat. Conversation feels like work. Sex drive falls. Hobbies disappear. Future plans stop feeling meaningful. Persistent hopelessness, guilt, or suicidal thoughts point far beyond simple appetite suppression. A rare but urgent pattern is unusually high energy with very little need for sleep. Rapid speech, impulsive spending, grand plans, reckless decisions, or severe irritability can signal mania. Mania is a state of unusually high or intensely irritable mood and needs prompt assessment, especially in someone with bipolar disorder. New suicidal thoughts, severe confusion, mania, or an inability to stay safe require urgent medical attention. Seeing or hearing things that are not there requires urgent attention too. In those situations, urgent medical evaluation and immediate safety come first. For less urgent changes, start with 3 questions. When did the change begin? Did it follow a dose increase? And is the loss of interest limited to food or spread across most of life? Those 3 questions usually provide more useful information than asking whether Ozempic changed your personality. Then check food, fluids, sleep, stomach symptoms, and alcohol use. How much is the person actually eating? Are they getting enough protein and fluids? Are they vomiting, constipated, or sleeping poorly? If diabetes medicines are involved, check whether blood sugar is running too low. Dose timing can make the cause clearer. Symptoms that worsen after a dose increase and improve after lowering it make the medication a more likely cause. That pattern is useful when discussing the next step with the doctor. Blood tests can help when the symptom pattern suggests another cause. Depending on the situation, doctors may check a blood count, thyroid function, salt levels in the blood, liver tests, or vitamin levels. Doctors should choose tests based on the symptoms instead of ordering every possible test. For mild symptoms, first address dehydration, eating too little, sleep problems, or frequent nausea when they are present. Then review the dose, timing, depression symptoms, anxiety symptoms, and other medications together. These steps help separate physical causes from broader mood changes. Consider 2 people who both stop enjoying restaurant meals. The first still enjoys music, work, friends, hobbies, and future plans. Food simply matters less. The second loses interest in almost everything and struggles to function. Those are not the same pattern, and they should not receive the same explanation. The phrase Ozempic personality is catchy because it mixes several different experiences together. Ozempic clearly affects appetite and how rewarding food feels. That can change food interest, routines, and social behavior. When mood or motivation changes more broadly, examine timing, nutrition, physical symptoms, other medications, and how well the person functions day to day. Medicine Simplified, that's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.